Good morning, everyone. This is Mary Beth Morgan. I am the benefit manager here at MCC. And today I'm going to be doing a very high level overview of all the benefit programs that we offer here at MCC so that you're all familiar with what we do offer. I find that from time to time, some of you don't know that we offer all these benefits. So I thought, doing a broad overview of all of them would be helpful. So, real quickly, I wanted to go over our statement of mission. In communion with the Catholic Church and in accordance with her teachings, MCC promotes a social order that respects human life and dignity and serves the common good through public policy advocacy and the administration of benefit and risk management services. So, in addition to the benefits, we started off as a public policy advocacy on behalf of the Catholic Church and the province in Michigan. But today we're going to be focusing on the employee benefit programs. And the programs actually fall into what I consider three buckets of benefits. We have the retirement plans that we offer. We offer health and welfare programs, which include medical, dental, vision, life, and disability. And then we have additional programs, which include the flexible benefit plan, unemployment, and the EAP. This slide goes over the eligibility requirements for the plans. And today I'm mostly going to be talking about benefits that are offered to lay employees. We also offer benefits and administer benefits for the clergy and religious employees. But mostly I'm going to be talking about the lay employee plans. The eligibility for the lay employees retirement plan is if an employee is scheduled to work 20 or more hours per week for 5 or more months per year in one or more units, they're eligible and earning credited service in the lay employee plan. The MCC 403B retirement savings plan is open to all regular employees, lay, religious, clergy can participate in the 403B plan. Temporary employees, seasonal employees cannot. The health and welfare plan and the EAP benefit programs are offered to employees who are regularly scheduled 20 or more hours per week at one unit. And then the unemployment, that covers all lay employees regardless of the scheduled hours that they work. So under the retirement plans, we have first the lay employees retirement plan. This plan was established by the board in 1966, so it's been around a while. And it was created to provide a retirement program for lay employees that are working at our parishes and schools. And it provides some financial assistance through a retirement benefit to those who have served the church throughout their career. It is a defined benefit church plan. It's fully paid for by the employers. There are no employee contributions. It's not a 401k or 403b. It is, again, all employer paid, and it is providing a monthly pension benefit to those participants who have enough years of credited service. And it provides that monthly benefit from the time they retire until the time they pass. There are joint survivor options that are offered. So if they want a benefit to continue to a beneficiary, if the retiree were to pass away, they can select an option that will do that. And again, the retirement benefit is based on years of credited service and their average annual compensation. On the other hand, the 403B retirement savings plan is a plan that offers the employee an opportunity to save for retirement. This is through payroll tax deduction, payroll deductions into a 403B. This plan was started in 2009. Prior to that, there were multiple 403B tax sheltered annuity plans throughout the province. And we decided that it would be a good idea to bring it all under one umbrella, makes the administration easier. And when you have all those investments under one umbrella, you get some economies of scale with investment opportunities and fees. This is a defined contribution retirement savings program. It offers the opportunity for participants to contribute to their savings either on a pre-tax basis, so the deductions are taken from their payroll before taxes, or they can make Roth or after-tax contributions into the plan, or a combination of both. Prudential Retirement is the record keeper for our 403B. So all transactions, all records are kept through them. And then they facilitate the investment of the funds according to the investment options that we offer um, to the participants. Health and welfare programs are a big part of what we do here. We offer the medical plans. There are currently 4 options that we offer to meet your employee needs. The 4 options are all offered through Blue Cross Blue Shield of Michigan, Blue Care Network of Michigan. Blue Care Network, Blue Elect Plus is our most recent plan offering. We began offering that on January 1 of this year. And then we have the PPO 1 through Blue Cross Blue Shield of Michigan, PPO 2, and PPO HD, which is the high deductible plan. Some of you offer all of these options. Some offer maybe 2 or 3 and not another, but all 4 are available if you wish. A little later in this presentation, I'm going to show you where you can go and get more detailed information about all these plans. As I said earlier, these are very general overviews today, but I'm going to help you find additional information, where to go to find additional information. On all the medical plans, you receive an annual rate renewal, and you see this map. And this map shows how we rate the Blue Care Network and the PPO plans. They're based geographically based on the healthcare costs, the regional healthcare costs in different parts of the state. And that's why we divide those 2 up, and that color codes it. And the rates are based on the zip code county where the parish is located. In addition to our medical plans, we have some extras that we have been adding on through the years to our medical plans for the plan participants to take advantage of. The first one we offered was the Livongo for diabetes. So our participants who have diabetes can take advantage of this. We also added the Livongo for hypertension. Both of these Livongo programs are for those who've been diagnosed, and it's to help them control their disease state, help them manage their health condition. And it provides lots of different resources, and we encourage people to take advantage of it, but they're not mandated. It's totally voluntary. Then we also offer some prescription drug add-ons. RX Saving Solutions was added on just a little over a year ago. It's a voluntary program that people can participate in that helps them potentially save money on their prescription drugs, helps them discuss medication options. Sometimes physicians prescribe a medication that is not on our formulary or is a higher cost drug. And so they can facilitate discussions to get maybe just as a drug that works just as well as a higher cost one, but for a lower copay. This is voluntary. They just suggest savings. None of it's mandatory. Pillar RX is another prescription drug program that is being rolled out on July 1, 2021. This program is in partnership with Blue Cross Blue Shield, targets high cost drugs that have pharmacy coupons, manufacturer coupons or rebates. It's going to affect a really small percentage of our population, and Pillar RX, Blue Cross Blue Shield, will be reaching out to them individually. It is a mandatory program and can save them money on their prescription drug costs and can save the plan money on their prescription drug costs. The next 2 items that fall under the health type plans are dental and vision. We offer one dental plan through Delta Dental of Michigan, and we offer a vision plan through Blue Cross Blue Shield of Michigan. Just back to this real quick. I see dental and vision plans as part of an overall wellness benefit because dentists and Optometrists, ophthalmologists can sometimes catch things early before somebody actually goes to a doctor to see them. So I encourage offering these. The Blue Vision, employees can is it's a very affordable benefit. Employees can pay for it themselves. Delta Dental, the dental plan, also can be an employer paid or employee paid or a combination thereof. It's something to think about if you're not offering those products right now. The next two items I want to talk about are our life insurance programs. We have two life insurance benefits that we offer. You can offer one or the other or both. I encourage both, of course. The basic life insurance includes an accidental death and dismemberment benefit. It is 100% paid by the employer. Employees cannot pay for the basic life. And you, as the employer, can choose whether you offer one times pay, one and a half, or two times annual pay level of benefit. The voluntary optional life benefit is actually 100% employee paid on an after tax basis. If you offer this, employees would pay through payroll deduction. We would invoice you, and they could choose between a $10,000 benefit, $25,000, $50,000, or $100,000 life benefit. And if they have at least 10,000 on themselves, they can also cover their children at for a $10,000 child option. Both these products are offered through Unum. They're fully insured and they're both portable. They are both also term life insurance policies as opposed to a whole life. So neither one of them have a cash value that accrues to them. Offering these benefits, as well as the disability benefit that I'm going to get into next, offers some financial wellness benefit to an employee and their family if something were to happen to the employee. Disability plans, they protect employee financial well-being when they're unable to work due to a disability. And that disability can be illness, injury, pregnancy, childbirth. Those are all things that fall under that disability category. It would not include any work-related disability. Any non-work related disability would fall into this category. We offer two plans, a short-term disability and a long-term disability plan. The STD is administered by MCC and it provides a benefit of 66.67% of an employee's base earnings. And it can go up to a 26-week period of disability. The long-term disability is administered by Unum and it's fully insured with them. It offers a benefit of 60% of their base earnings. And this would begin after our short-term disability benefit expired. You can offer short-term or long-term. You don't have to offer both, or you can offer both. We have units that do one or the other. It just depends on what you think your employees may need. But disability benefits are pretty low cost and high value to those that actually become disabled and unable to work. It provides that level of financial wellness to them. The next area I'd like to talk about is our flexible benefit plan. The flexible benefit plan, also known as a cafeteria plan, it's a Section 125 church flexible benefit plan. And this plan is what allows you to take pre-tax contributions for the employee share of medical, dental, or vision programs. It also allows for the flexible spending accounts that we offer, the dependent care and health care. And if you so wish, you can provide cash in lieu of taking a medical plan. So if an employee has other qualified medical coverage and you want to encourage them to opt out of our plan, or they choose to, and you want to give them a little boost, this is what this is, a cash in lieu of, if they have other qualified benefit health plan. You need to verify that every year with the employee if you choose to do that. A lot of you are familiar with the flexible spending accounts that we offer. This is through Health Equity. We have a healthcare flex spending account and a dependent care flex spending account. There are no employer administrative fees for offering this program, just as there are no administrative fees for offering the 403B. And then you just pay the premiums for all the other programs. There are advantages to you for people when people do participate because you lower your FICA Medicare taxes, um, along with the employee getting the benefit of having pay for these benefits on a non-taxable basis. The one program that has taken up a big chunk of our time this year is the unemployment insurance program. Under this program, MCC facilitates the exchange of information between participating units and the state of Michigan Unemployment Insurance Agency. So we submit the quarterly wage data, so you don't have to worry about doing that. We respond to requests for information. Oftentimes, we do have to reach out to the unit to get a little bit more information um, regarding somebody's unemployment insurance claim, but we will navigate that and help facilitate that exchange of information. We keep an eye on claim activity, and we would represent you at an unemployment insurance hearing if a claim was under dispute. Participating units do not have to interact with the unemployment insurance agency at all. We take that off your shoulders and take care of that for you. We don't we don't pay the claims, we monitor the claims. So we are not adjudicating any unemployment claims. If a claim is paid and you are suspect of it and you want to challenge it, we can help you with that, but we're not doing that actual payment or determination of any claim. LifeWorks Employee Assistance Program and Wellbeing Solution is another program that we rolled out in 2020. And I think EAPs are very valuable and they can help build on a well-being program for employees. This one is considered a modern employee assistance program because it offers short-term counseling on a wide range of issues. It's not just substance abuse, the way EAP started off years ago. We get this through LifeWorks, which is a Morneau Chappelle product. In addition to the short-term counseling, and that counseling can be done in person, online, video conferencing. They offer various platforms and can be done in lots of different languages upon request. It also offers the well-being resources, which is their web-based platform or an app. And you can, if you haven't already gone out and checked that out, they have a lot of different resources for employees and for employers that you can use to help with your employees. It also offers perks and savings. So if you go out to their website and you get there by linking to it through the employee self-serve, you can check out discount programs and other perks that LifeWorks makes available. All benefit eligible employees can take advantage of the LifeWorks EAP. It is at no charge to you and no charge to the employee. I just wanted to tell you, we also administer clergy benefits. So I just wanted to give you a list of the clergy benefits that we do offer and administer on your behalf. Clergy benefits, the plans that are offered to your priests are actually determined at the diocesan level. So if you're interested in this and you're not offering it now, you would see it on your invoice. If you were, you can check with your diocesan contact about these. All but the auto, the last one, are offered through the employee benefits. Auto is offered through our risk department. So where to find information? Our website is where you go to get a lot of information about everything that MCC does, including our advocacy program, the risk management program, and also what I'd like to think is the most important thing is the benefit program. And all you need to do is go out to www.micatholic.org and you will arrive at this page and you just select the benefit plan that you want to get more information on, and you can find it here. This is also where you can access the bookkeeper toolkit and get our procedures guide, find out about our webinars and look at back webinars, get documents and forms that you might need. There's some information about the employee assistance program, And this is where you can also link out to the employee self-serve and get to the LifeWorks EAP website. So you've looked at all these plans and you realize, you know what, maybe we do want to offer the vision that we haven't been offering. How do we go about doing that? So what we need to have you do is if you ever want to make a change, add, change, or remove a benefit plan, we ask that you complete a unit setup and change form. This can be found out on our website under documents and forms. Um, we ask that you complete it and have the authorized decision maker in your unit sign it. Usually, if you're a parish, that's going to be a pastor. Sign off on this, and then you send it to us for January 1 effective date. We need the forms back by September 1. For a July effective date, we would have needed those back by May 1 to be effective July 1, 2021. But these are ongoing dates. With so many units, we needed to set some parameters around when we could actually make changes. And so this is the cadence on which benefit plan changes can be made. So do we have any questions? I know this was very high level, but I'm happy to answer any questions you might have.
We had one question from Teresa asking if an employee can pay for short-term or long-term disability, or if the employer does not offer it.
No, if you are offering short or long-term, it must be employer paid. So the benefits that can have an employee share are medical, dental, vision, and the optional life. The basic life isn't 100% employer share. Short term is 100% employer paid. Long term is 100% employer paid.
Kristen would like to know if,
go ahead. I'm sorry.
Kristen would like to know if the unit gets notified when an unemployment claim comes through, but go ahead and finish your final thought.
Yes, we would reach out to the unit. Usually there's a request for information. Reason why somebody terminated is the typical reason why we would reach out to them. Or if they want to dispute it. So yes, we would notify you, send an email, and then upload the request for information form out onto Bookkeeper Self-Serve.
Marion would like to know if they need to opt in for the BCN plan or only opt out if they don't want it.
You have to opt out if you don't want it. So, and typically when we offer a new benefit program, we ask that you offer it for at least 1 year and then opt out. But yeah, anybody who offered health insurance as of January 1, 2021, the BCN plan was added to their menu of options.
Tori would like to know when an employee should select a joint beneficiary for a lay retirement to continue payment after death.
You should name a beneficiary. You vest after 5 years. So once you have 5 years of credited service, you're vested. You should have a beneficiary on record then. So I recommend that you get the beneficiary named right away, since you're probably not going to remember after 4 or 5 years that you need to go back in and name a beneficiary. So I recommend doing that right out the gate. And then that can be changed at any time. And when you go to retire, if that isn't the beneficiary that you really want to get your joint and survivor, you can change it at that time. You can never change it once you start your retirement benefit, you're locked into the benefit that you have.
Monica would like to know if unemployment claims are behind schedule in general, I think.
Well, I mean, the Unemployment Insurance Agency was not set up to take the incredible amount of unemployment claims that started coming in March and April of last year. As far as I know, I think they're pretty well caught up. I can double check on that, but I am not aware that they are behind at all any longer. If there is a problem with an unemployment insurance claim, and if you have a specific question about one, you can reach out to us and we'd be happy to try to find out what's going on. The interesting thing about unemployment is if a person has, more than one employer in their benefit period, we can't go in and see exactly everything that's going on in a claimant's situation, but we can, get a little bit of information. But yeah, we're happy to take any specific questions if you want to just send a message to the benefit mailbox or call us on our 800 number, which here's our contact information. Um, the benefit email address is benefits@micatholic.org, or you can call us at 800-395-5565.
And just in case, I don't think the question was to address this, but just in case it is, we are 2 months in arrears for unemployment invoicing. So the invoice that you get
Okay. Yeah.
would be behind schedule. So I don't think that that's what the question is about, but just in case, yeah, the invoice is a couple months behind for what we bill for. And that is because we have to gather wages. And obviously we can't gather the wages for the current billing period. So we have to do it in arrears.
Right.
All right. The next one is for optional life insurance. Is there a health exam required for participants?
There is not upon when they're initially offered the program. So newly eligible employees would not have to provide evidence of insurability. That's the term. So they wouldn't have to answer a health questionnaire. But if they do not enroll when it's initially offered and they want to enroll at a later date, yes, they would have to provide evidence of insurability. There is a link, right? And they would normally do that through the open enrollment process. And so on the during the open enrollment process, when they go through ESS, there is a link directly to the Unum Evidence of Insurability questionnaire. They answer it, it goes right to Unum, and then Unum makes that determination whether they be approved or if they need more medical or they're declined. And all that communication would go right back to the employee. MCC and the employer never sees the health information that is shared with Unum.
Do FSA funds expire at the end of each year, or is it use it or lose it?
Typically, and I say typically because the rules were changed this year, but typically it is, there is a forfeiture of unused funds at the end of the plan year, calendar year, for dependent care reimbursement accounts. For healthcare, we allow up to $500 to roll over from year to year. That is typical. For 20 to 21, due to COVID, the rules changed and the monies were allowed to roll over for both accounts from plan year 2020 to 2021. But that will not be the case going forward unless the permanent rules change or are extended.
Is there a recommended cash in lieu amount?
I believe the maximum is 2,500.
All right. What happens to the money paid for pension funds when the employee leaves before the 5-year vesting period?
Again, that money is not going into an account that is earmarked for the employee. It's a defined benefit plan. That money is collected and used to pay benefits for all participants, not just for that specific individual. So it stays and invested in the lay employees retirement plan.
Bonnie would like a quick description of what credited service means.
Credit service is based on the plan year. So if a person works in covered employment, which means they're in a position where they're scheduled to work 20 or more hours per week, they earn credit service. If they work at least 5 months of the year, through 5 months of the year, they get a full year of credited service. If they work less than that, they get a partial year of credit service based on the number of months. So, 3 divided by 12 if they only work 3 months. So they're earning that credited service. And once they have 5 years of credited service, they are vested in the plan, which means they have a right to take a pension benefit based on those years and their average annual compensation at time of retirement.
And the last one in the list here regarding flexible spending accounts, are the employees issued a plastic card to use in conjunction with their savings account?
If they are in the healthcare flex spending account, they do get a flex card from Health Equity.
Which is new this year, right?
That is new this year. Those we switched from Meritain to Health Equity as of January 1. Health Equity does issue a flex card, and they can use it for that. They do need to still be able to substantiate how they're using that money. So keep your receipts and provide them to Health Equity upon request, and keep them for 7 years because you can be audited.
Lisa Ford wants to know, she only received one FSA card and wants to know if her husband should have gotten one also.
You have to request a second card. I believe you can do, and Tiffany might have to correct me on this, but I think you can call Health Equity or go online and request a second card when you log into your account online. If not, we can help facilitate that.
And how do we determine what the amount will be for retirement benefits?
If you're asking for yourself, you can go out to the employee self-serve website and do estimates on that. But basically, the pension benefit is based on your number of years of credited service times your average annual compensation times 1.5%, divided by 12 is your monthly benefit. Now, the benefits were slightly different than that prior to January 1 of 2011. So there's a frozen benefit for people who worked prior to that, that's calculated slightly differently. Average compensation is based on your 10 highest years of compensation, not 10 consecutive highest, not your last 10, but the 10 highest. There is a plan document, a summary of plan provisions out on the website that kind of goes through all that and explains how the pension benefit is calculated. MCC benefit team can run calculation estimates for employees upon request. But again, you can also do that on ESS. Again, these are estimates based on what date somebody's going to retire. If it's projecting out in the future, it's going to do an estimate on what earnings are. So anything that we do is based on the estimate and the parameters given to us either on the system or to the team when they're doing estimates.
All right, very good. That looks like the extent of the questions.
Okay. I just wanted to go over the contact list real quick. If any of you are considering adding programs and you have questions, could you reach out to Isabel Hershey? She's our customer success and training coordinator, and Isabel can help facilitate completion of the unit change forms. Send them to her because she will be the one who kind of gathers and makes sure that everybody gets them. So anytime you have a training need or a question need, she can help facilitate that. General questions on employee benefits can go to our benefits team. And then if anything escalates up with a benefit matter, you can reach out to Tiffany Gallegos, the assistant benefit manager, or myself. I am the manager. Well, thank you so much for joining us today and your excellent questions. The webinar will be available out on our website, probably maybe tomorrow sometime. And we can provide a PDF slide deck of this as well upon request if you just want to send an email to Tiffany, Isabel, or myself, and we can help get that out to you.